cost perspective, what the experts who favor this plan say is the Republican plan would have increased coverage to about 3 million people versus the 32 million people that the Democrats say their plan will cover, and that for every person that's covered, that will impact the premiums of people who are now paying for the uncompensated care that goes on in the hospital, and that the estimate is between $1,000 and $1,200 of people's premiums go to that. So if you're looking at this not just from a social, we should cover everyone because it's a good thing, from a cost perspective, is it not cost effective to have everyone covered and have this individual mandate?
I don't believe so, but I also think your question illustrates a subtle but very important shift in the way this healthcare debate unfolded. So the healthcare debate started with a discussion of lowering the cost of healthcare to improve the accessibility to healthcare. That is a worthy goal. It is a goal I support. And unfortunately, what happened over the course of the healthcare debate is it shifted from, we're going to lower the cost of healthcare to improve accessibility, to, let's cover all the uninsured.
Well, let me just stop you for a second because you quoted the CBO. The CBO says that the deficit will decrease by $143 billion over 10 years.
Yeah, but you know,
and when you talk about the cost will increase, the premiums will rise for those people who get a better set of coverages, but that if you stay with the same coverage you have, that your premium will not go up.
Yeah. Well, you know, I don't mean to be disrespectful to the CBO, but if I got to budget the way they do, you know, the numbers would always look good all the time. I mean, let's look realistically at what it took to get that score out of the CBO. First, let's acknowledge that the number that President Obama throws around, which is this is going to decrease the deficit by $1.3 trillion, is
That's over 20 years. Yeah.
It's over 20 years, and the CBO has said specifically that any projection past year 10 is not reliable. Well, of course,
what about 143 over 10? Is that chump change?
It's not chump change. It's not real. So if you look at how they got there, they did a couple things. They threw the student loan program in. They decided, oh, you know what, we're going to cut Medicare another $50 billion. We're going to raise taxes another $50 billion. I mean, they moved the numbers around to make the numbers come out the way they wanted them to come out. I understand that game. People try and do it all the time. But the reality is that having done that, it could be $143 billion, it could be $243 billion above. I have never seen a government program or a government budget that met its budget. Never. Medicare hasn't, Social Security hasn't, Medicaid hasn't, and this probably won't. Beyond that, as you point out, Dina, in your question, what the CBO says is their projection is that health insurance premiums will rise 10 to 13%. Why do they assume that? Well, we can look at the track record in healthcare that we see today, and we know that one of the reasons that private insurance premiums go up is because government programs don't adequately reimburse for healthcare services provided. So therefore, the healthcare providers end up putting more of the costs on private insurers. And I think it's not a stretch to say that nothing in Obamacare is going to shift that basic dynamic that goes on in the healthcare system today. I mean, to me, what we've done with Obamacare is take all of the flaws in the existing system and magnify them.